Do you have a lifestyle plan to deal with COVID? Hi, I'm Bernice Hunt, and I am a brain health specialist. I work with women just like you who are starting to notice a few memory challenges, and I help you to stay sharp so that as you age, you can still travel, have fun with your grandkids, and experience new adventures without missing a beat. As an entrepreneur for over 20 years, I remember what good old Benjamin Franklin has said: if you fail to plan, you're planning to fail. Now, did you catch my last video? I had a video a few days ago about going on the offense when it comes to COVID. If you didn't catch it, you can still find it on my YouTube channel, Keep Your Brain Sharp, or on my Facebook page. It's there. But today I wanted to go a little deeper and talk to you specifically about how you can tweak your lifestyle in terms of what you should eat, what you shouldn't eat, what you should do, what you shouldn't do. So that's what we're going to talk about today, okay? Now, we've been told a lot of practical suggestions when it comes to COVID, like washing your hands frequently, wearing a mask, when you need to, and even taking vaccinations. So those things we know to do. But you may not know that there are some lifestyle changes you can make that will lower your risk of getting COVID. Also, the severity, if you do get COVID, how severe it is, and also the longevity of those COVID symptoms. So that's what I want to talk about, because there's just far too many people that are faced with those, especially long-term COVID symptoms these days. Fortunately, hospitalizations when it comes to COVID have gone down. In fact, they say that 8 out of 10 people that actually get COVID have mild or sometimes even no symptoms, which is a really good thing. But don't get it twisted, because even though it's the older adults that a lot of times are hospitalized, or the very young infants or people with chronic illnesses that get into the hospital, there's still something out there called long COVID. And even if you have mild symptoms, and even sometimes if you have no symptoms, after your little bout with COVID, you think it's over, you get what they call long COVID. And those symptoms creep up on you, and it is no joke. Some of you might be wondering, why are you talking about COVID and this is supposed to be about the brain? Ask some people that have had COVID. They've noticed some things going on up there in their brain. And it wasn't, for a lot of people, it wasn't just when they actually were infected with the COVID virus, but it was afterwards when they were over the virus and then these symptoms came on them. And it is no joke, because doctors don't have a treatment for it. And also, people aren't sure when and if they're going to get over it. So not only are the symptoms one thing to deal with, they have to deal with the stress that comes with not knowing how long this thing is going to last, how long they have to deal with it, and if it's ever going to go away. That creates long-term stress, chronic stress, a low level of stress. That is not good, because you know by now that any stress in your body is not a good thing. And so that's not a good thing, to have that stressful feeling with you all the time. Now, what is long COVID? Well, it's when you get symptoms like 4 weeks after COVID is over, you still have some things going on. And those things going on are different for different people. And sometimes you didn't even have those symptoms when you actually had COVID, but you may now get tired all the time. You're dealing with fatigue. Some people even deal with fevers. A lot of people deal with brain fog. Okay, and they can have a variety of other issues with your heart, with your respiratory system, with your digestive system, and of course with your neurological system going on. And exactly what happens varies between people, but everyone can tell you they know they don't feel the same. Things are different. They don't understand what's going on, and so that becomes an issue. And the research is telling us that it's beginning to look like that the lifestyle does play a part in your pre-COVID and post-COVID experience. It has something to do with it. There's a study that was done in Harvard, and they dealt with some women that were healthy women, and they followed them after they got COVID. And they found out that these healthy women had a 30% lower risk of having COVID symptoms that would keep them from doing their regular routine. 30% lower chance that was going to happen if they had a healthy lifestyle before they got COVID. And even if they did get COVID, about half of them had a lower risk of having long COVID symptoms. And so that can make a difference, guys. That can make a difference in your life if you have a healthy body to begin with. And so they compared that with women who weren't having a healthy lifestyle. So you might be asking, okay, so what is a healthy lifestyle? Good question. What is a healthy lifestyle? So they have some points that they want you to be aware of. Number one, lose that excess body weight. Excess pounds have got to go, guys. It is detrimental to your health in a lot of ways, and it makes you have a harder times, a lot of times, dealing with COVID or post-COVID symptoms. Okay, so I'm talking about losing that weight, not that roller coaster yo-yo type of dieting, but losing it and keeping it off. And most experts are telling you to do that. You probably are going to have a plant-based diet, okay? Plant-based diet is one of the preventative diets that they recommend when you're talking about preventing COVID or preventing long COVID. Okay, so what do I mean by plant-based diet? You probably know, but I'm going to tell you anyway. Okay, by plant-based diet, I'm talking about eating lots and lots of veggies and berries. Okay, I'm talking about eating an ample amount of legumes and nuts and seeds and healthy fats. And by legumes, we're really talking about beans and peas. Okay, basically eat a lot of those. Regularly have that in your diet, as well as healthy nuts and seeds, raw, unroasted, not the caramelized or candied or salted or whatever, healthy nuts and seeds and your healthy fats. Okay, then I'm also talking about eating less meat, less dairy. Okay, I'm talking about limiting those processed foods. I'm not going to tell you to eliminate them, but some people, just cut me off at that point. But limited amount of processed foods, okay? And also limited or even eliminate, if you can, the alcohol. Okay, so that's what a healthy diet looks like. All right, a plant-based diet is what you want. And I'm going to add to that. I'm going to add fasting of some sort. At some point during the day, you need to push yourself away from that table. You do not eat 24/7. Okay, that's not how our body was designed. That's not what you should be doing. It's really easy to do that these days, but it's not what you should be doing. And fasting can look several different ways, but at some point you have a window of time when you are not eating. And I'm not just talking about when you're not sleeping. I'm talking about not sleeping. Don't eat, of course, in your sleep. That's kind of hard to do anyway. But sometime during the day, you're not going to be eating as well for a certain amount of hours. Okay, I'll get off that. All right, so plant-based diet. Number 2 is sleep. Having a healthy weight and sleep were the 2 strongest habits that you could have that were lowering your risk for long COVID, okay? So we're talking 7 to 9 hours of quality sleep, guys, because your brain and your body needs to reboot. And it takes a certain amount of time to do that, where they have to reorganize, they have to regenerate new cells, they have to reduce all those waste that are in there in your brain and stuff. They have to renew things. They have to repair things. It has things to do. So it needs to put you in a comatose position where you're not running around, so you can take care of stuff that needs to be cared of. Okay, those are the 2 most important factors that had to do with reduced risk of long COVID. Okay, the other things though was exercise. They say exercise is the fountain of youth. They just don't say that to be saying that. There's a lot of good benefits with exercise. You need to exercise on a regular basis, some sort of exercise. And they say the best exercise is the one you gonna do. So find something you like to do and do it, okay? Exercise regularly. Okay, another thing is to maintain your stress, okay? Get a cap on that stress level. Because you have to have, there's going to be stress in your life. You can't eliminate stress. But you have to balance it. You have to manage it, okay? When I say maintenance, I'm talking about managing your stress, okay? So we're talking about some intentional things you're going to do on a regular basis to get yourself back into that calm state. So whether that's deep breathing, whether that's yoga, Pilates, whether that's meditation, whether that's getting out into nature and just relaxing out, nature walks, whatever, intentional things you do to calm yourself down, okay? And then the last thing, if you are still smoking, stop smoking. Period. It is not, there's no benefit that's good for you, and it's detrimental to you, as you know. So just, get some support of what you need to do, but stop smoking if you haven't already stopped, okay? So there you have it, guys. That is the plan, okay? The ball is in your court. What you gonna do with it? Because there's some things you definitely can do. Tweak some of those things. It's a process, but make a decision and start tweaking it. Now, you want some support in that? I am happy to help you. I am excited about my text messaging service. It's a free service that I started a few months ago. Text messaging service where I can send about a week, every week or so, I send some educational tips and some information I think will be helpful to you straight to your phone. And you can also respond back to me as well so that you can be encouraged and supported in your efforts. Okay, so if you're interested in that, I can't just send it to you guys. You have to register and give me permission to invade your life. Okay, so I'm going to leave the link for you for the subscription so you can go ahead and fill out that information and I can get it to you. And the first thing I'm going to send you is going to be a list of foods that help you boost your immune system to help you fight against COVID and long COVID, okay? So you want to get that list. You want to start tweaking your diet that way because your brain's destiny is in your hands.